Welcome. This is Friday Reports. I'm Dr. Gloria Wu, and this is an iteration of Health Talk, and our topic today is long COVID. This is July 1st, 2022, and we've been in this COVID pandemic for over 2 years in America. And now we're seeing, in my practice, long COVID several times a week. So many of our patients are young people in their 20s, 30s, and 40s, and they're complaining that as tech workers and software engineers, they cannot see without feeling some sense of pain or eye pain, or that they cannot concentrate long enough to do their usual 1 hour of coding or software work. And we look into their eyes, we dilate them, and we find some interesting findings. Sometimes they're 20/20 vision, which is perfect vision, but they all notice that the vision is abnormal to them. So what happens, we see tiny little hemorrhages around the center of their eye, around the fovea and the macula. Macula means spot in Greek, and that's the center of vision, which gives you the best vision, the best color vision. So even though their vision is 20/20, by our testing methods, they're seeing something subjectively abnormal. Now these we know will go away in 6 months or so. So we're happy to report this is good, that people will return to normal. Many of these people have had COVID despite having had 2 vaccinations and a booster. So these are breakthrough infections, which is very common. As we know that Omicron variant is very contagious, so many people are getting this now as more and more people are not wearing masks, are enjoying themselves, going to bars, picnics, barbecues, as this is the summer. As the CDC predicted that they thought there would be a surge in June and July, so this is correct. In addition, we're seeing many people also complaining of double vision, inability to focus and drive, and sometimes they have a 3rd nerve palsy, a 4th nerve palsy, or a 6th nerve palsy. That means that their eye muscle doesn't move correctly, so their eye muscle is somewhat paralyzed, so their eye is deviated slightly out or in or some sort of mid-range, so that they're not able to focus for a long time. So if that happens, see your doctor right away, see an ophthalmologist, an IMD. The other things to be worried about is a lot of people don't know if they got a COVID infection at all after their vaccination. They think that they just have the common cold. So what is worrisome, if you think you only have a common cold, is that, do you have a fever? Do you feel very tired? Do you feel more tired than normal? Get a COVID home test and think about it. And because you don't want to infect your loved ones or your roommates or your children or your neighbors or your coworkers. So think about that. In addition, we know that if you have long COVID, women are affected more than men, and that we don't know why. And we also don't know, and we cannot predict yet, because we don't have enough data, who will get long COVID. Some people get COVID again as a breakthrough infection after vaccination, and they feel fine, nothing ever happens. They never come to my office or any doctor's office. Other people, within 2 weeks after getting a COVID and recovering from COVID, they start feeling these symptoms that they cannot see, or they see double. So it's hard to predict who will get it, so it's like a Russian roulette, and we want you to see your eye doctor and see your internal medicine doctor if need be. Now, some people, when they get sick, a breakthrough infection of COVID, despite being vaccinated and having a booster shot, they don't know that if they have a fever, they should go see their internal medicine doctor right away, because they could get Paxlovid, which would help you shorten the course and make you recover faster. And especially in those people who have asthma, high blood pressure, or they have some amount of overweight, obesity, diabetes, they should definitely go to their internal medicine doctor right away for evaluation. All this is all very confusing to many people, so we're doing this today as a service to the public to let people know how to best take care of themselves during COVID-19. In addition, if you do get long COVID, remember, it's a virus, and that you can get tested for COVID spike protein to find out how your antibodies are doing. And lastly, because you're still kind of sick, that you need to get rest, to have a healthy diet, drink fluids, do not run a marathon, do not do something so strenuous that you can have a relapse. Some people have relapse, and then they get something of a long COVID called long-term chronic fatigue syndrome. We don't wish this on any of our patients because it's very debilitating. You feel you cannot get out of bed, and so we want you to take this seriously. So take care of yourself. If you get a breakthrough COVID infection despite vaccination, take care of yourself. Do not push the envelope and decide to do 2 marathons and stay up all day, all night, and drink lots of coffee and pretend you're normal. So take it easy. Have a wonderful summer and take care of yourself. And thank you for joining us.